Intertransverse ligament friction. Support the head gently with one hand and place the tip of your thumb in the fist position or index finger on the uppermost transverse process. Apply pressure toward the midline and slowly friction in an anterior to posterior direction, always taking the skin with you. Use whichever finger is most comfortable for you, and switch hands and fingers frequently so they don't become strained. Gradually work your way down, frictioning each ligament. Friction both the upper edge of the transverse process, which works the ligament attachment above, and the lower edge, which works the ligament attachment to the transverse process below. One variation of this technique that's more restful for the hand is to reach under the neck and use the middle or index finger to friction the ligaments on the opposite side. This works better for some practitioners. Another variation is to tilt the head away from the side you're working on. This sometimes gives you better access to the ligaments. Generally, you'll perform intertransverse ligament friction for several levels, and then repeat the same technique on the opposite side. If the intertransverse ligaments are very tender, you might alternate between right and left at each level. If there is not much discomfort, you might work all the way down before switching to the other side. Work on each tender structure for 1 to 2 minutes, depending on the client's tolerance. If many ligaments are injured, which is often the case, spend less time on each of the structures and keep coming back to them. This may be easier for the client to tolerate until the pain diminishes. Remember to make your movements very, very small. Find each transverse process. Go slightly superior to it or slightly inferior to it and friction. Watch the client's face and check in frequently about the level of discomfort so that you don't get carried away. There are also other structures in this area that occasionally get inflamed. The capsules of the zygapophyseal joints. These are the hard surfaces you'll feel just posterior to the transverse processes. If any of the capsules are tender to the touch, work there for a while as well, using the same types of small movements.